Ms Traynor.
Good afternoon, my Lord. Good afternoon. I wonder if you could begin by telling us your full name.
My name's Whyte.
And you're here, I think, in your capacity as Assistant Head of Business in Family Placement at Barnardo, Scotland.
That's correct, yes.
You have provided a statement for the inquiry, and for our purposes, the reference number for that statement is SCIWT 0247, 5 zeros and then a 1. And you should understand that that statement has been read and will be available to the inquiry to use as evidence. I wonder if you could start by telling us how long you've been in your current role for.
I've been in my current role with Barnardo since early March 2021.
And before that, I think we see from your statement just at paragraph 7 that you were the registered manager of an independent fostering service prior to your role with Barnardo's, is that right?
That's correct, yes.
And is that role similar and in a similar sector to the role that you currently hold?
Yes, the same sector and a similar role covering all of Scotland.
In your current role, are you able to give us an overview as to what that involves and what your responsibilities are?
Yeah, my role is to oversee the statutory services and implementation of the standards for the fostering and adoption of children and young people across Scotland. And that includes the recruitment of foster carers and also the safety and welfare and standards for children and young people placed in fostering and adoption homes.
And are you involved in essentially matching children to adoptive placements that you identify and run?
Yes, a large part of our work is matching those children and young people referred to our services to those foster carers who are part of our Barnardo's fostering service.
Are you able to give us a sense of how many placements in children and young people that you're currently dealing with in foster care and adoptive placements?
Yeah, we currently support about 170 children and young people across our Scotland services, and we also have 19 approved adoptive families in our adoption service, and that includes the children and young people 12 children and young people who are placed with those adoptive families. We have an adoption support service, and our adoption support service currently supports around 160 adoptive families, and that could be adoptees or adopters or birth families.
The services that you've described in terms of fostering and adoption, are they overseen by the Care Inspectorate?
They are, yes.
And in your role, can I presume that you effectively manage teams which work directly with carers, children and young people?
Carers, children and young people, and work in collaboration with our local authorities.
In your statement, I think it's at paragraph 34, you say that Barnardo specialise in securing placements for children who, if the placement were perhaps to be sourced by the local authority, they might wait the longest. What do you mean by that?
Barnardo specialises in those children that wait the longest, so those children could be children who have experienced placement breakdowns, so several moves from fostering homes, or children with additional needs, particularly for children who are placed for adoption. So we specialise in trying to match and place those children who perhaps wait the longest.
One of the other things I think you mentioned in terms of that might be larger sibling groups, is that right?
Yes. Predominantly our referrals from the local authority have taken the trend of larger sibling groups, and it could be sibling groups, brothers and sisters up to 5, where we would try and place in close proximity with our foster carers so that we can maintain that connection with the families, and also children and young people who perhaps are a sibling group of 3 who can be placed together in a fostering home or in an adoptive home.
And another thing I think you very briefly mention is perhaps children from different ethnic and cultural backgrounds that might be difficult to place in local authority placements.
Yes, that's correct.
In your statement, you tell us about various ways in which your service was impacted by the pandemic, and I wondered if it might make sense to start with the issue of the recruitment of both foster carers and adoptive carers. First of all, are you able to give us a general idea as to how prospective foster carers were recruited prior to the pandemic?
We would have a number of ways that we would try and recruit our foster carers, and that could be advertising online through social media, but it's also about being in local communities and local venues, looking at, could be schools, could be fairs, could be local, just local amenities where we would offer the opportunity for people to come forward to inquire a little bit more about fostering or adoption, but largely face-to-face prior to COVID.
And I presume from you saying that the usual course of recruitment perhaps changed following the pandemic, and particularly in March, the lockdown. Can you tell me how it changed?
It changed significantly because we were no longer able to be invisible out in the community. So we had to rely very heavily on the internet. We had to rely very heavily on social media to put the same information and to try and give that relevant information to anyone who may want to inquire to become a foster carer or an adoptive parent. So everything had to change to be online and to be social and to be advertised through social media.
I think you express within your statement that perhaps that created a particular challenge in connecting with people who might be less confident in using the internet.
Yes.
Are you able to expand on that?
Yes, I think it's a lot of our local communities, sometimes their internet is not, they don't have good connection. So, you know, people are also less likely to get the information in that face-to-face connection to understand what fostering entails rather than reading something online. So those people that, you know, you're correct in saying that are perhaps not as confident in using the internet, we are unable to reach those people who may then have come forward and may have talked to us on a face-to-face event or out within the local community.
You go on, beginning I think at paragraph 64 in your statement, you really identify a number of trends which the service has seen throughout and then perhaps since the pandemic. And you say the number of foster care inquiries decreased significantly. Are you aware about, first of all, whether that continues to be the case, and also perhaps the reasons for that?
There's a continued decline in the number of inquiries coming forward to be foster carers, and that's been across a period of 4 years. So we've seen a steady decline year on year. That could be about change in lifestyle, it could be about financial circumstances, it could be lack of awareness and understanding of what fostering actually entails. Conversely, the number of adoptive inquiries increased.
I wonder if I could ask you further about adoption in a moment, but you also indicate, I think, that the number of resignations of current foster carers during the pandemic increased.
Yes, that's right. We had a high number of foster carers, particularly during 21 and 22, who tendered their resignation. Some of that was due to retirement, but some of that was due to feeling unable to continue in their role as foster carers, either returning to full-time work or actually more of a caring responsibility for their own families and feeling unable to care for another child in their home.
And can I presume from the fact that you've put it in this statement that you attribute that to the pandemic rather than other factors?
Yes, I think people, when we gather the information, when foster carers wish to resign, we will talk to foster carers to try and gather the reasons for that. And the majority of the reasons, whilst they're varied, were about change in lifestyle, about financial circumstances, but also wanted to take their life and their circumstances in a different direction. You
say, relative to foster placements, that there are perhaps different needs now, and one of the things that you identify is that there is a greater need for larger sibling groups than previously. I wonder if you can expand on that.
We've seen an increasing trend, and I think predominantly the introduction of the promise places the importance on giving brothers and sisters the opportunity to stay together. And so the number of referrals to our service has increased for sibling groups, as I said previously, for 3 or 4. And it could be 5 in some circumstances of varying ages of children.
Are we to understand from your reference to the promise then that you don't necessarily think that that's attributable to the pandemic?
I don't think it's directly related to the pandemic.
And you go on, and you've mentioned it in your evidence already, that there was the number of adoption inquiries increased, and I think you say increased hugely. The increase was very much looking for babies and much younger children. I wonder if you can tell us about that.
It's very hard to understand fully the picture of why adoption inquiries have increased, but IVF, for instance, had stopped. There was no longer the opportunity to explore that for parents or for prospective parents. And again, I think change in lifestyle and people taking stock of their life and where it was at that moment in time, wishing to then become a family and to adopt children.
These changes and general trends in terms of recruiting both foster carers and adoptive carers, are they changes which you saw over a relatively short period, or did they persist to this day?
The number of reduction of inquiries for foster carers continues to decline, as I said previously. So we've seen a steady decline over the last 4 years, and that's across the social sector. That's not particular to Barnardo's. The number of adoptive inquiries has slowed, but we are quite particular in Barnardo's about adopters who we would want to take through and support, and that's in relation to those children's needs that are placed on the adoption register. So we would try to match them very closely.
That leads, I think, to another area which I wanted to explore with you, that being the process of assessing and training the carers that you recruit. Firstly, am I right in thinking that Barnardo's completes, actually yourselves as an organisation complete the initial assessments of prospective carers?
That's correct, yes.
And why are those assessments and perhaps the quality of those so important?
It's hugely important that people have a good awareness and an understanding of the role of a foster carer or the role of an adoptive parent and some of the challenges that may bring with children within their home. And so it has to be scrutinised and assessed quite carefully, and it can be quite intrusive for people coming forward, which in the main they understand, and they understand the reasons why the assessment has to be so in depth and so carefully managed throughout that assessment journey.
You mentioned there about the in-depth nature and perhaps even an intrusive nature as to the assessments. I think within your statement, particularly at paragraph 21, you go on to say the local authority stopped assessments of new carers and new placements, but conversely, you carried on.
Yeah.
Why was that?
We continued to look at different ways that we could recruit and assess our foster carers and adopters, and predominantly Barnardo's as a charity, all our income comes from our local authorities who would refer children and young people to our service. And if we don't have the foster carers or indeed the adopters to match for those children that need those placements, we really don't have an income. But the need for, I think the continued need for children and young people and being aware of the need of those children waiting was a driver for Barnardo's to continue those assessments.
Are you aware, or did you manage to get a sense of why others, including local authorities, might have stopped doing the assessment?
I think it's quite difficult to understand, and it's quite difficult to comment on the exact reasons that they ceased. It could have been about methods that they used or methods that wasn't available to them that we were able to act on quicker. So online methods and the way of connecting with those families who wanted to come forward. Not all local authorities stopped, but some did. and perhaps with adoption that may have increased the number of inquiries to our service because we continued to do those assessments and carry out those assessments.
Just in brief terms, are you able to outline the differences between the assessment process before the pandemic and then the assessment process when the lockdown occurred?
Prior to the pandemic, we would visit initially and we would have that face-to-face. We would then continue to have at least 12, 14 visits to that family, and as well as if they were a couple, we would continue to do those individual visits and assessments to make sure that they had the opportunity to talk to us on a one-to-one basis. We were unable to do that. During the pandemic, we still continued to do some visits. That was because we really needed to see the home. It's very difficult to see that on an online platform. So we had to visit the home to try and still get a feel for the home and for the couple or the person that was coming forward to be a foster carer or adopter. So predominantly it moved to online. And the checks, I think, all had to move to online, so GP checks and disclosure checks, they all took a little longer because all systems slowed down.
Do you think that the changes that you required to implement had any impact on the quality of the assessment?
We continued to follow the assessment process, but I think it is fair to say that there were, for some people, differences in how they expected and how they envisaged fostering, predominantly fostering, would be for them and having another child into their home. So for some couples and for some people, they were not approved for very long and didn't have a child in their care for very long before they either resigned or we had to take them back to look at whether they could continue to be registered because the expectations of what fostering would be like was not the same.
Can I take it from that then that perhaps you have seen an impact on fosters who were assessed during that period, subsequently, perhaps, I think you say in your statement, not appearing fostering ready?
Yes, because everything was online, the training was online, the opportunity to talk with other foster carers, to meet with other foster carers as part of that training, which is assessed as part of how people interact with a group, was unable to be assessed face-to-face and all had to be done online. So I think that's fair to say it had an impact.
And you indicated there perhaps expectations of foster carers were different during that period.
Yes, the lived experience of having a child in their home to care for did not match what their view was about what it would be like.
You mentioned, I think very briefly there, that there are also training processes which happened online, so ongoing training of carers rather than just simply the initial assessment.
Yes.
Again, I have a similar question. Do you think that those moving online affected the quality of the training that the carers received?
It changed the quality. I'm not sure about the impact of the difference and whether it was less or not. We implemented the same training, but the group work that we could do that required people to be face-to-face had to change. So it was very different, and it was a different experience for those carers pre-pandemic to during pandemic.
Within your statement, I think you also do identify some benefits to that. I wonder if you can tell us briefly if the benefits to perhaps some of the training moving online.
The ongoing training has benefits. If people are a couple, usually one person is working full-time or is working and one person is in the home. So it gave us a greater opportunity, and it gave the couples or the person greater opportunity to navigate that whilst they were either working from home to be online and to reduce the travel to attend the training.
Are there aspects of that which have continued since matters have returned somewhat to normal?
Yes, we've continued with some online training. We do have face-to-face training, and we also have adopted some hybrid training where we will have our adopters or we will have our foster carers come together in a group with a facilitator, and the other facilitator can be online. So it reduces the travel for the foster carers or the adopters whilst maintaining that online, but they still have that connection with one another.
One of the aspects which you indicate is important to the ongoing assessment of a placement is unannounced visits. I wonder, did that at all stop during the pandemic, or was that always a feature that unannounced visits took place?
Yeah, we adopted online unannounced visits. And that was very different, where we would have a video call, and the foster carer would take us through the home. That's very different to being face-to-face and unannounced visits, but we then had to change quite quickly to making sure that we could do it within the safe parameters and within the restrictions that we had. So, for instance, our staff would drive to the foster carer's home and have a call with them outside to say that they were sitting outside, to make sure that there was safety, safety measures within the home. So people had PPE equipment to allow and enable our social workers to come in and carry out an unannounced visit, which is a regulated requirement of fostering services.
You say, I think at paragraph 74 of your statement, a lot of social work is face-to-face intuition and being able to read situations. Can I take it from that your view is really it's essential to have an aspect of these assessments and training and check-ups that are face-to-face?
Absolutely. And whilst we have to be able to read reactions to questions, reactions to situations, and so that takes into account body language, facial expressions. So, our training and experience is about understanding those reactions in people to some of the questions that we would have to ask, and it's very difficult to do that online when you can't read the body cues and you can't see as well facial expressions or pick up on those anxieties.
You also narrate that the organisation has a support service available for foster carers and adoptive carers, and that comprises, I think, of an online aspect and also a helpline.
That's right.
And at paragraph 59, you say that foster carers relied on support from your team more during the pandemic than previously. Can you tell me more about that?
Yeah, we operate a 24/7 helpline. It is a helpline as opposed to an emergency line because we still rely on the local authority duty out of our system. It's manned by 2 qualified social workers, and it's the opportunity for foster carers or adopters to let us know of any crisis or anything that we would class as a notifiable incident that we have to report to our care inspector. The support systems that were around for foster carers, which is a huge part of the success of a fostering family, so family, friends, other foster carers, was no longer there, and it was all online. So they heavily relied on our social work support, and some of that support, whilst it may not be crisis, it was crisis for them, where they required additional assistance and additional help, and to talk to someone, their social worker.
Has that continued post-pandemic, or is that now something which has returned to the previous levels?
It's beginning to return to the previous levels, but it has taken some time. It's taken some time to renew those connections with those foster carers, and for that relationship to be re-established. Family, not so much. Family was easier, and the support from family was easier, but maintaining those connections and re-establishing those connections with foster carer supports, and also our therapeutic support, was a little bit more time-consuming and challenging, so that takes time.
You discuss the implications which the pandemic had on the safeguarding responsibilities that Barnardo's felt, I think at paragraph 77 to 79 of your statement, and you say that your team were required to take on more of a safeguarding role than they had previously. I wonder if you can expand on that.
I think it was very difficult for local authorities and also for ourselves, where we work in geographical areas predominantly, so a lot of our social workers would support foster carers in close vicinity to where they live. So any safeguarding concerns or any statutory visits, we had to limit the amount of people that were in the home, but we also had to undertake the safeguarding visits to ensure the welfare of the children and young people, particularly where there were allegations. And at times, the local authority either didn't have the staff or the staff weren't in the geographical area or due to sickness or absence. So we worked in collaboration with them to carry out those statutory requirements to make sure that the safeguarding was still in place.
And from that, are you able to give us a sense of perhaps what the safeguarding concerns were during that time and how they might have been different to prior to the pandemic?
Safeguarding concerns could be anything from an allegation, a child making a disclosure against a foster carer where we would need to visit to ensure the safety of the child or young person, or it could be about a child or young person who had gone missing or left the family home without consent. It could be about an incident within the home where young people's behaviour had become so challenging that it involved physical or physical violence towards the foster carers. So any of those would be required to have a visit, and we would respond to that.
Was there anything that you were seeing more of?
Some of the behaviours of our children and young people were really challenging for our foster carers, and I think those behaviours increased because the foster carers were also teachers. They had to be family members. They had to manage the family time with their birth family, and that can be quite difficult for a child in their care to understand the differences between those boundaries. And so some of the boundaries became blurred. That had undoubtedly impacted on the behaviours for the children and young people.
Within your statement, you also raised the issue that the service was under an increased burden of reporting. And by that, I think you mean reporting to the care inspectorate, is that right?
Yes, that's right. Mm-hmm.
And what was that increased burden?
That was about the number of children and young people who had contracted COVID. And if you had 4 or 3 children within that fostering home, it required a separate report for each of those children, but it also included our foster carers and our staff. So managers within our service had an increased responsibility to report that, and we had time constraints in which to report that. So it did mean some after-hours reporting to our care inspectorate, which is an online service as well.
And are those reporting obligations still in place?
Some are. So for the reporting for if staffing falls below a certain level, we have to report that to the inspectors. But the remainder of that is returned to pre-COVID, so we don't have the same reporting responsibilities as we did.
I think you say that in turn, that increased responsibility to do all of those things perhaps impacted on already a diminished number of staff who were continuing to provide a service.
Yes.
You discuss, of course, in your statement the impact that you saw on looked after children and young people, and in particular the systems which took place in order effectively to implement a child's plan. I wonder, first of all, can you tell us what you mean by a child's plan?
Child's plan is when a child comes into our care, we need to understand what the plan for that child is. At times they could be placed with our foster carers on an emergency basis and we have very little information, or an interim basis, which is up to a year, or they could be placed on a permanent basis, which is anything over 2 years. And so it's very difficult, I think, to map and assist and support that child or young person when we don't have a clear plan, and when those clear plans are discussed and agreed through looked after children's reviews or children's plan reviews through our children's hearing system. And when that all slowed and stopped, the plans slowed and stopped. So children's care plans that perhaps would have been agreed and implemented over a period of 6 to 12 months then took much longer. So a child being placed in interim care with their foster carers could be over the 2 years because the plans hadn't been agreed or hadn't been implemented, because no looked after review was able to take place.
So in your experience, did looked after and accommodated children reviews stop taking place?
They drifted. They didn't stop altogether, but they did drift.
I think you use that language, drifted, in relation to various aspects of the systems, one of which is the children's hearing system.
Yes.
And I think you indicate that initially that stopped for a period, and then it took place via other means, telephone and then online.
Yes.
You talk a bit about the impact that has had on the children and young people who are subject to the hearings. And at paragraph 55, you say, we almost assume at times that young people are very used to being online and working with online, but not in meetings like this.
That's right. It's really different, the way that young people connect online. We were then asking them to attend almost formal meetings through a children's hearing system online. But not only that, that was in the safety of their foster home. And to have that meeting and to almost have that sense of safety taken away where something is being discussed in your place of safety was a real challenge for our children and young people, and indeed for our foster carers.
So almost a sense of intrusion into
Yes.
their own personal space.
Yes.
You also say within that paragraph that the meetings were not particularly child-centric, and I wondered what you meant by that.
Some of the language used, we have to be very careful about some of the language used. We have to make sure that the child or young person understands, and indeed in the implementation of the promise, a lot of that is about language and making sure that we're implementing those views of what the young people are telling us about the language that's used. So some of those formal meetings where the language is used must have been very difficult for them to understand, and there's then heavily reliant either on the social worker or the foster carer to explain that to the child or young person.
And how did you see that manifesting? Were you, for example, as a service, hearing from young people that they were finding these hearings really difficult?
Yes, they wouldn't so much tell us that it was difficult, but their behaviour would say that. So they wouldn't want to attend the meetings, to say they didn't want to come, they didn't want to know what was happening and that we could tell them afterwards, or refusal to attend completely. So you could see the anxiety level, and some of that is recorded. We record it quite clearly within our either carer diary of a child's journey or child and young person's record. So it could be quite clearly captured about some of the issues and anxieties and upset that they were facing either prior to a hearing or prior to a meeting or a formal meeting, and then afterwards.
Did you get a sense of any way that the procedure might be improved to allow people to express, or young people to express their views in a way that might be more comfortable for them, even if it wasn't a face-to-face meeting?
I think what we tried very hard to do was try to get the young person's views so that we could advocate their voices and their views on their behalf without them actually being present either in the hearing or being present within their review. I think we do like to hear from children and young people. We do like to see children and young people, but we need to understand better the pressures that places on them. And there's a variety of ways that we do that. And again, children and young people are telling us, you ask us too much. So we need to be able to understand and observe that over a period of time so that we're able to give their views accurately without asking them at every hearing or at every meeting what their views are with regards to their plan or with regards to their future.
Moving on from children's hearings to talk a bit about more formal orders that were granted or by courts, you, at paragraph 118, talk about permanence orders, and you say that that process drifted like the other processes did, but it's still significantly delayed. Is that continues to be your experience as a service?
Yes, not in all cases, but in some cases, some are significantly delayed. And that is about systems, it is about courts, it can be about staffing, it can be about the staffing changes, so staffing changes within local authority. And if one person leaves, somebody else has to take up the permanency order to lodge that in court to make sure that everything goes through. And that's hugely difficult, but it holds up the system. But the impact on that on our children and young people is profound. And that has slowed, in your view, because of the pandemic? Yes, because the courts that no longer took priority within the courts, but also those plans are agreed prior to a permanency order being lodged. So those looked after children review meetings that drifted were unable to make those recommendations and decisions for the child and young person's future. So everything drifted.
We should be able to get times for the court's delays, because times are logged for how long. They've got times, as you know, to get through the court system.
Yes.
Which, well, Ms. Traynor will know better even than I do, are not always adhered to. No. But we do keep records of them. Yes. We better get those records, I think, Ms. Traynor. Yes. Yeah.
You mentioned that has effectively all of the individual processes drifting, and that potentially culminating in a court order having taken a lot longer to get to that process. You mentioned that had a profound impact on children and young people. What do you mean by that, and can you explain that a little bit further?
If a child or young person is in an interim foster home, and those foster carers may not wish to become permanent foster carers for those children, because some foster carers want to come forward to assist children and young people and to help them move on to their permanent or forever home or reunification with their birth family. So that's part of our in-depth assessment, to understand those needs for those foster carers. So, for instance, if a child or young person was placed with an interim foster carer, that could drift. And because if we're looking for permanent foster carers, that's a different assessment that we have to, and different matching that we have to look for. And, you know, that if we don't know, we can't predict or we can't look to search and match for that permanent foster home for that child or young person. And so in effect, that child or young person is living in limbo, you know, not knowing where am I going to be next year, where am I going to be, and all we can do, and all the foster carers can do, to try and reassure them that for now, they're wanted and they belong here. But we can't tell them what's going to happen in the future. And that does have an impact on behaviours, thoughts, mental health.
Can I take it from what you're saying that your experience has been that children perhaps can end up in what were interim placements for a lot longer than what was intended initially?
Yes, that's correct. That's correct. And then we, as part of our process and part of our regulatory requirements, would need to assess and take our foster carers back to a fostering panel to vary their approval. So if they're approved as an interim foster carer, we would need to take them back and vary them for a long-term foster home, or as long-term foster carers.
We've discussed the impact on children and young people, but you might imagine perhaps that might have an impact on the carers themselves and their expectations as to the placement not coming to fruition. Has it had an impact on foster carers and their essentially their willingness to offer placements?
Yes, and I think perhaps that could be some of the reasons why fostering or foster carers have decided to resign and no longer continue to be foster carers. And also it could be about those foster carers coming forward and inquiring to be foster carers just because of the uncertainty of it. So, we have seen a decline, as I'd mentioned earlier, in the number of foster carers coming forward, but also in an increase in fostering resignations.
Moving on to adoption, you say, I think at paragraph 45 of your statement, that before COVID, a rough approximation is that it could take 3 to 6 months from matching an adoptive family to the court process being finalised. And then say, when COVID hit, adoption orders have been taking a year, sometimes 2 years. Yeah. Adoption orders are a little bit complicated. It really just depends if the birth family are contesting that adoption, and so that can take some time to make sure that the views of the birth family are understood and that they're given their right to appeal. So some of it can be that, but some of it is the court process and also the children's hearing. So that comes into that comes into that whole regulatory process where the children's hearing cannot move a child or young person into an adoptive home unless that adopter has been approved and matched to that child. So some of that can take a little bit longer. So I think essentially all of the drift ends up in a lot of uncertainty. Yes. You discuss at paragraph 52, you relate, I think, some of that drift to an impact on what you call family time. I think family time is now what we call contact with birth parents. That's right. And you say that that delay and that drift impacted on that family time. Do we take it to mean that it negatively impacted on that that time that birth families could spend with their children and young people? Yes, I think it did have an impact in those fractured connections. It was very difficult during lockdown and during the restrictions to manage any connections or any family time or contact, as it is commonly known, between children and young people and their birth family. And the children's hearing, for instance, does have the position to be able to say that contact needs to take place and stipulates how often that needs to take place, and that can then impact on the foster home, or it could then impact on the contact if that child is about to be placed in an adoptive home. In your experience, was it ever the case that direct contact was stopped simply because of the lockdown restrictions and the people being prevented from having face-to-face contact? It was done differently. So it was never stopped, but we had to be very careful with those restrictions that were in place. So face-to-face time, it's very, how can you can't do face-to-face time with a child or young person and expect that child or young person not to make physical contact with their birth family. And so that was hugely difficult to manage. You had fostering homes who perhaps had an underlying health issue or had anxieties about catching COVID. And if that was the child or young person was then mixing with their birth family, could they have contracted it and could they take that back into the foster home? And that all impacted on, I think it all impacted on, how often and the willingness of the child or young person and the willingness of the foster carers to continue to manage that contact. Is it the case that some of the contact moved to online effectively? Yes. And in your experience, how did children and young people manage that transition? That was really hard for children and young people. Children and young people, we know, I think children don't
don't connect very well over the phones at times, and there's a lot of distractions in the family home. There's a lot of distractions in the foster home, which could be equally challenging and difficult for the birth family to see. So the reactions to young people, their birth children not engaging with them because there was other distractions in the family home, was huge, and the implications of that on how they then managed the remainder of that time impacted on the child or young person, but also on the foster carers. And again, it's connecting in that safe foster home with where the young person or your child or young person feels safe, and having someone FaceTime or having someone on the phone can impact on that.
I suppose usually contact takes place out with the foster home in a different venue, either a social work centre or another kind of neutral venue. That contact, I suppose, is what you're saying, is then being brought into the home.
Yes, that's right.
And you saw that being difficult for young people?
Yes, it was difficult for young people, but it was also difficult for foster carers. Foster carers almost have they have a very important role in managing the conflict between the birth family and the social work department, and so they are almost like the middleman. So they try to, our foster carers try as hard as possible to build up a positive relationship, because that has a positive impact on the children and young people. And if there's conflict, whether it was online or whether that was contact socially distant and face to face, if the foster carer had to step in, that then blurs that role and boundary again for the birth family, but also for the child and young person.
What difficulties did you see between birth families and foster carers? Are you able to give us any examples?
It could be inappropriate language. It could be, you're coming home to me soon. It could be those conversations that you can't prevent but are said, and the impact on that child and young person. Then, oh, am I coming home soon? So either being anxious about going home or having that hope of returning home is really challenging, because at times, and most of the time, there is a social work either assistant or there's a social worker available who's able to manage that. But at times, because of the restrictions of the number of people, the foster carers had to manage that.
We've spoken about contact between, or family time between birth parents and children, but I wondered, do you have any experience about whether sibling contact continued to take place if children, for example, were in different placements?
We did try to maintain those connections, but again, with the restrictions in place, it was very challenging. It was challenging to manage the anxieties of each of the foster homes where the children were in for fear of being infected with COVID. And so we had to try and restrict those numbers. And perhaps if there was 3 children or 3 or 4 children who met and had the opportunity to come together, that had to be restricted. And so that severs some of the connections and some of the brother and sister time that they had. It had to be managed individually, and it had to be managed differently.
You say generally within your statement, overall, there was less opportunity to have contact with parents and siblings. Can you tell us if you think this has had any lasting impact on children and young people who are placed in care?
I think it's fair to say that we don't fully know the impact that it's having on, or it's had on children and young people at this stage. But it's also fair to say, I think, that relationships have been fractured, and that's really challenging to bring those relationships back together, and it happens over time. As I said earlier, it's not something that can just happen overnight, and it's something that has to be facilitated and something that has to be managed over time. But it did have an impact.
You go on in your statement to discuss the issue of mental health, I think at paragraph 108, and you narrate that there has effectively been an impact, and that local authorities are responsible for CAMHS referrals, so it's difficult for you as a third sector to champion for that, but you have employed yourselves child psychotherapists who have been able to assist. And I wondered, through that resource, are you able to tell us what the experience has been in terms of impact of mental health?
We employed our child psychotherapists to work with our foster carers and with our children and young people. So not so much one-to-one time with that child and young person, but to try and understand the dynamics and the circumstances of what's happening within that family. If there's any areas of concern, or if there's any areas of anxiety that perhaps could lead to a disruption. So the psychotherapists, I think, are beginning to build up that community and trust in our foster carers, but also in our children and young people and in our social workers. And it's to ensure that we have a team around the child and a team around the foster carers to understand that. So it has assisted in that, but we don't at all times have one-to-one or would refer the child to our child psychotherapists. I think what did impact was we had play therapists and art therapists, and they were employed as part of our service previously. However, that one-to-one time, because a lot of it is play, a lot of it is interaction, couldn't happen, and that had to cease. But trying to explain that to the child or young person was really hard to do, but also the impact on not being able to express themselves through play or through skilled therapy had an impact on the fostering, had an impact on their behaviour, which had an impact on their foster home and their foster parents.
So there are services I think that children were used to seeing and used to having, and people they're used to seeing, and they weren't able to see those people, and your service users had to explain to them why that was taking place. Yes,
that's right.
You mentioned that there was an immediate impact in terms of the lockdown on children and young people not having a connection with peers. And I think you say teenagers don't necessarily always want to interact with their caregivers, and that was an important support network for them. Can you tell us more about the impact that on their mental health that might have had, that you saw?
We saw adolescents, I think, and teenagers becoming more isolated, not wishing to interact, becoming more isolated in their rooms, having anxieties that they were unable to explain, perhaps about COVID, but also about where their future was, what their future plans were. And young people won't necessarily voice what their anxieties are, but they tell us in other ways through their behaviour. They can tell us through observation. So, and young people, I think, we see having more challenges running away, more self-harm, more instances of misuse of online platforms, and so that has continued, I think, through lockdown and continued after lockdown. And we saw the number of disruptions increase during during the lockdown period and as we come out. So the number of children, young people that had to be moved from their foster homes increased.
Disruptions to placements?
To placements, yes.
I wonder, so the disruptions particularly, are you able to pin that down to the period during the pandemic, it being significantly different to both before and after?
The numbers are significantly different from during lockdown to pre-COVID, and they have slowed down.
So we're returning, hopefully, to less disruptions?
Yes.
I'm interested in one of the comments that you make in paragraph 110. You talk about the impact on younger people, younger children, trying to readjust and being reintegrated. And you say, how do you play with other people your age? Is that something that the service has experienced, that children are finding it difficult to interact with each other?
Yes, I think no school, no opportunity to be in playgroups, no opportunity to be with other children from other foster homes, that during lockdown had an impact on, one, their feeling of isolation, but also, yes, how do they interact with other young people and how do they play, particularly younger ones. Well, they became quite used to an adult world, so they would interact and they would have that connection and that attachment with with their caregivers, but less so with their peers, because there was no community activities, because there was no schooling.
And as an organisation, were you able to support the carers in perhaps training or something else in order to deal with these immediate effects of isolation and perhaps reducing mental health in children?
We introduced a number of suggestions, a number of online platforms, a number of supports and supervisions through gameplay, through having family time. But again, if you're predominantly a child in with adults around you, how do you do that through play? When there's no other children there, to demonstrate and observe and assist that young person to learn how to play with someone of a similar age. So that can be quite challenging to do, but certainly our online training with regards to therapeutic parenting and parenting children through trauma takes a variety of different platforms through training, through gameplay, through just on learning and understanding about the impact of trauma and how that can impact on children and young people.
You get a sense within your statement that you really, at the time, I think, were dealing with an environment which was changing quite quickly. And I wondered how you as an organisation felt that was dealt with, and whether the guidance that you were given was sufficient to allow you to provide the service that you wanted to provide.
We very much interpreted the guidelines and the restrictions and the changes that were happening and tried to work our way around that alongside the local authority and alongside our care inspector, just to make sure that we were adhering to the needs of our children and young people and what they were telling us, balancing that with restrictions and also the risk of increasing disease and increasing COVID amongst families and households. So it's quite difficult to say that the guidelines that were implemented were not adequate or not right. I think we adhered to that. It must have been very difficult to administer restrictions when there was so much disease and so much transmission of COVID versus the risks of children and young people. But what we did try to do was balance the risks of the children and young people's welfare with those restrictions. And at times we did go into family homes, but what we did is document that quite clearly and the reasons for that, whether it was a child protection or a safeguarding visit.
Did you feel as if the information that you were being given was specifically geared or even explicit about looked after children? Or did you require to interpret the guidelines for those circumstances?
No, it very much relied on our administrative and business services and safety teams interpreting that guidance and guidelines for us, specifically to looked after children. And I think it was more general, looked after children. It was more general children and young people, in the general public, rather than specifically looked after children or caregivers of looked after children.
Do you recall there being any specific information given to you about relationships with birth families and siblings? Because that, to me, seems like the position that looked after children and young people are in which is very different from the general population in that they have an external family who they don't live with. And was there any information given to you about what you should do about contact?
There was information through the Children's Hearing and from the Care Inspectorate that where contact still had to take place, or where it was important to take place. So, for instance, if assessments were ongoing for a child to be reunited back to the birth family, there had to be a way to continue that. So we had to manage our way around making sure that the child or young person had that opportunity and the birth family had the opportunity to continue to meet. So it didn't stop altogether. It was very dependent on the plans for that child or young person. If they were placed on a permanent basis and perhaps contact with birth family was limited, it may have been restricted or pulled back, but certainly where it was stipulated within the Children's Hearing, that continued, and we continued to do that. And I think we worked in collaboration with our local authorities to make sure that we managed those risks quite carefully and continued with that contact.
How did you, as an organisation, find disseminating the information to the users of your service, the potential carers, and also the children of young people?
It certainly was a challenge. It was a challenge to distribute and communicate with carers online. We couldn't assume that carers, one, were interpreting that guidance, so we had to follow that up and make sure that we were having that connection through telephone call or you know, whatever online method it was, to make sure that they understood those new guidelines or those new restrictions that were coming in. We also had to understand, we also had to help understand that there was some restrictions depending on the geographical area that you were living in. So, you know, perhaps Highland was different from Glasgow, and we had to make sure that that information went to each of our fostering families within their local authority area. But that was through online, it was through follow-up connections with telephone calls and in collaboration with our local authorities to understand that we were interpreting it the same.
The last paragraph of your statement indicates that your hope for this inquiry is that the experience of children and families during lockdown can be better understood, and this can be used to inform future decision making and ensuring children are properly supported.
Yeah.
Have you had an opportunity to reflect on how that might manifest?
I think it's fair to say we will not know the lasting impact for children and young people, but particularly our looked after children and young people and their caregivers. And we may not know, that might have a less lasting impact for some time to come. So I think it's really important that we understand that, and we don't necessarily focus on children and young people in general, but that we do have a focus for our looked after children and young people to make sure that the impact and lessons implement any future recommendations going forward, so that there are those supports there for our children and young people.
And is there any way that your organisation is attempting to monitor those lasting impacts and perhaps learn lessons yourself about looked after children and young people during that time?
We are, you know, Barnardo's are championing, as all services are, the promise. So that was hugely impacted because the promise was circulated, was implemented, and a week later we went into lockdown. So we are working behind to try and make sure that we uphold each of the requirements and responsibility for the promise for our children and young people. But that has drifted again because of lockdown and because of our inability to do that. But we certainly will have connections with our MSPs, and we continue to champion the needs for children's mental health, for instance, and have those connections with our local authorities and also with MPs to make sure that their looked after children population voices are heard.
Those, I think, are all of the questions that I have for you, but I wondered if there was anything which we haven't covered which you might want to raise.
No, there's nothing, Sarah. I think all that I would say was about the drift and the challenge that it was for Barnardo's and for most all local authorities, I would say, to uphold the promise. And so, you know, that's hugely important for our children and young people who have expressed their voices. So it's really important that we continue to try and make up that lost time.
Thank you very much.
Yes, indeed. Thank you very much, Mrs. Whyte.
Thank you.
Very good. Thank you. That's all for today. 9:45 tomorrow morning. Thank you.